1 in 3 adults over the age of 40 is trapped in a relentless cycle of chronic lower back pain at this very moment. Half of all women who have gone through childbirth are dealing with the daily humiliation of urinary leakage in total silence, and the medical establishment hasn't spent 5 minutes explaining to them why it's actually happening. Millions of Americans are wasting years of their lives struggling with chronic constipation, painful hemorrhoids, and a protruding lower abdomen that refuses to flatten, regardless of how clean they eat or how many thousands of crunches they grind out at the gym. Every single one of those seemingly unrelated problems, the back pain, the leakage, the digestive failure, traces back to one small, deep, and heavily neglected muscle that nobody in the mainstream is willing to talk about. You won't hear it mentioned during your annual physical. You won't see it on a poster at the gym, and it certainly isn't being addressed in the vast majority of standard doctors' offices. It is called the Puborectalis. I'm Dr. Elias Thorne. I've spent 15 years in the clinical trenches watching patients suffer through expensive procedures and long-term prescriptions that could have been completely avoided if a physician had simply sat them down and explained the mechanical truth just once. But I'll be perfectly candid with you. The traditional healthcare system is not financially incentivized to make you permanently well. A cured patient is a lost revenue stream for the pharmacy and the surgical center. They profit from your return visits and your managed decline, not from your independence. If you're ready to stop being a customer for the industry and start being the master of your own biological blueprints, you need to subscribe to this channel and hit the like button right now. What I'm about to reveal to you will never be covered in a standard, insurance-mandated 15-minute appointment where the doctor is looking at a clock instead of your chart. We are building a community of people who value clinical truth over corporate profit, and we need to hit our growth milestones to keep this information from being suppressed by the algorithms. Let's look at the actual architecture of your body. We'll start with the anatomy, but I'm going to keep it strictly tactical. Your pelvic floor isn't just one single muscle that you can squeeze away. It is a high-performance, multi-layered platform of muscle and connective tissue stretched between your pelvic bones at the absolute base of your torso. You need to visualize it as the structural foundation of your body's entire lower unit. It acts as the floor that supports your bladder, your rectum, your uterus if you're a woman, and your prostate if you're a man. The puborectalis is the sling of the deep layer within this platform. It possesses a mechanical job that no other structure in the human body can duplicate. It wraps around your rectum, the final exit point of your large intestine, like a U-shaped loop. It anchors to your pubic bone at the front, travels all the way back, loops around the rectum, and pulls forward with constant tension. This physical pull creates what we call the anorectal angle. In a healthy, normal state, this angle creates a roughly 90-degree kink in the hose of your digestive tract. That 90-degree kink is the only reason you have bowel control. It is a brilliant piece of biological engineering. When you aren't in the bathroom, that sling stays taut, keeping the pipe closed through sheer mechanical force. When you are ready to eliminate, that muscle is designed to consciously relax. The angle opens up and waste moves out naturally. No straining, no force, no damage. That is the biological intent of the human machine. But here is where the insider knowledge reveals the systemic failure. The Puborectalis doesn't operate in a vacuum. It is actually part of a high-pressure, three-stage system. You have your diaphragm sitting just below your lungs, your transverse abdominis wrapping around your trunk like a wide internal tactical belt, and the pelvic floor acting as the base. These three structures are supposed to act as a single, perfectly coordinated piston. When you take a breath in, the diaphragm drops, and the internal pressure within your abdominal cavity rises. In a functional body, the pelvic floor gently yields and lowers to catch that load. When you exhale, the floor lifts back up as the diaphragm rises. This is the rhythmic, constant cycle that manages the internal pressure of your life. When the system is calibrated, that pressure is distributed equally in every direction, upward, outward, and downward. Your belly stays flat without effort, your lower back remains stable, and your joints move without friction. You don't even think about it because the hardware is doing its job. However, when the system breaks down, and in our culture it is almost always broken, that pressure follows the path of least resistance. And that path is almost invariably straight down, hammering relentlessly into the pelvic floor. That is the exact moment the symptoms emerge. You leak when you cough. Your lower back starts to throb with a dull ache. Your sacrum feels like it's been welded shut. The establishment sees these as 5 separate medical conditions. I see them as 5 different faces of one foundational failure in that deep sling muscle. Here is where the medical industry gets it dangerously, and I suspect deliberately, wrong. There are 2 opposite ways this system fails, but the establishment only wants to talk about the one they can sell you a quick fix for. The first failure mode is hypotonia, which simply means low muscle tone. This is the weak sling you see in the television commercials. You sneeze, you cough, you jump, or you lift a heavy box, and your internal pressure spikes in a fraction of a second. Because the muscle is slack, it cannot hold the line. Urine leaks. The industry calls this stress urinary incontinence. And stress here doesn't mean your job is hard. It means physical force was applied to a system that wasn't strong enough to resist it. Along with the leakage, the belly begins to pouch forward because the deep stabilization network has failed to engage. Your internal organs start a slow downward descent. Now, I want to be completely honest about hypotonia. The internet has made it the default diagnosis for everything. A woman leaks when she sneezes, and every algorithm immediately floods her with ads for Kegel exercises. For a muscle that is genuinely weak and underactive, squeezing and contracting the floor makes physiological sense. But here is the clinical reality they are hiding from you. Low tone is actually the less common of the 2 failure modes. In 15 years of private practice, the patients who come to me convinced they have a weak pelvic floor are almost always walking around with a floor that is locked in a permanent, suffocating spasm. It hasn't shut down, it is locked up. This is hypertonia, and it is the epidemic the industry is ignoring. I remember a patient named Linda who came to see me a few years back. She was 47 and had been battling chronic constipation for most of her adult life. She had hemorrhoids that her gastroenterologist was managing with a rotation of creams and generic fiber supplements, chasing symptoms while ignoring the source. She also had what her previous doctor dismissed as non-specific lower back pain. Linda had been religiously doing Kegel exercises every single day for 8 months because she read it on a blog and no one told her otherwise. When I asked her how she felt after nearly a year of clenching her pelvic floor, she looked at me and said, "Worse." Linda's story isn't the exception. It is the absolute rule in modern medicine. Hypertonia means your puborectalis is in a state of emergency contraction. It never fully lets go. The sling stays tight even when you are sitting in the bathroom trying to function. That anorectal angle I mentioned, it never opens up. So you strain. You push against a biological dead end. That straining drives massive internal pressure directly into the walls of your rectum and the sensitive blood vessels surrounding it. That specific mechanism, sustained, repeated straining against a muscle that refuses to release, is the primary engine driving hemorrhoid formation and anal fissures. Hemorrhoids are just swollen, damaged veins. A fissure is a physical tear in the lining. People spend decades buying over-the-counter stool softeners, but the management never becomes a cure because no one ever addressed the locked muscle that was creating the blockage in the first place. Why is every pelvic floor in America in a state of chronic spasm? Look at the environment we've built. Chronic psychological stress is at the top of the list. Your body interprets ongoing anxiety as a literal physical threat, and one of its oldest evolutionary responses is to tighten the base of your trunk to protect your vital organs. It's an ancient reflex that protected your ancestors from predators, but it is now creating a permanent cramp in your pelvis. Combine that with prolonged sitting, especially that forward-leaning posture we all use at our desks or in our cars. You are creating sustained mechanical compression on the perineum, the soft tissue between your sit bones. You are literally crushing the blood flow to the region for 8 hours a day. Throw in shallow chest breathing and the system collapses. If you never engage your diaphragm deeply, your pelvic floor never receives the rhythmic, top-down pressure wave it needs to stay supple and elastic. It stiffens gradually, the way any living tissue stiffens when it stops being moved. And don't expect a spine doctor or an orthopedic surgeon to connect this to your back pain. They aren't looking at the foundation. When your pelvic floor is locked, your sacroiliac joints, the connections between your sacrum and your pelvic bones, lose their range of motion. Your sacrum freezes. When the base of your core is rigid, the deep muscles that stabilize your vertebrae are forced into emergency compensatory overwork. They stay contracted just to keep you upright. Your lumbar vertebrae begin to absorb excessive, uneven loads. The result? Chronic lower back pain that doesn't respond to massage, doesn't respond to anti-inflammatories, and laughs at physical therapy that only focuses on the back. You cannot fix the roof if the foundation is sinking. The pelvic floor is the source, and that is where the clinical work has to happen. There is a second consequence of this chronic spasm that most people attribute to getting old or low energy. When the pelvic floor is locked, your diaphragm cannot descend. The floor is too tight to allow the pressure to move downward. so your breathing stays shallow and confined to your upper chest. This shallow breathing ruins your internal drainage. Your veins and lymphatic vessels rely on that diaphragmatic pump to carry waste and fluid out of the pelvic region. When that pump fails, fluid pools in the pelvis. The clinical result is a constant sense of heaviness in the lower abdomen, chronic fatigue that no amount of caffeine can fix, and a crashing libido. The cycle feeds itself. The spasm ruins the breathing, the poor breathing worsens the spasm, and your body eventually accepts this compressed, starved state as normal. It is not normal. It is a system in failure. I need to stop and address what I consider to be the single most widespread and genuinely destructive piece of health advice currently circulating on the internet: the blind, universal recommendation of Kegel exercises for every pelvic floor problem under the sun. Kegel exercises were introduced back in the 1940s as a non-surgical treatment for one very specific condition: urinary incontinence caused by low muscle tone. For a muscle that is genuinely weak and underactive, hypotonia, the approach makes perfect physiological sense. You are strengthening a slack structure. But for a muscle that is already locked in a chronic emergency spasm, performing a Kegel is like repeatedly clenching a muscle that is already in the middle of a cramp. You aren't helping it. You are deepening the dysfunction and cementing the pain. I have seen patients grind through months of conscientious Kegel exercises only to end up with escalating pelvic pain, worsening constipation, and a lower back that feels like it's made of glass. All because no one took 10 minutes to assess which condition they actually had before handing them a generic exercise protocol. If your pelvic floor is in spasm, what it needs is the exact opposite of a contraction. It needs lengthening, it needs a release of tension, and it needs to be retrained through coordinated diaphragmatic breathing. Here is exactly what we are going to do. 2 specific movements: no expensive equipment, no monthly fees, and entirely appropriate for any age or physical condition. The goal here isn't to make the muscle stronger in the way a gym trainer would describe it. The goal is to restore its elasticity, its ability to lengthen on demand and move rhythmically with your breath, instead of remaining braced around the clock like it's waiting for an impact. Movement 1. Child's pose with diaphragmatic breathing. This is a targeted decompression of your lower unit. Kneel on a comfortable surface, lower your hips toward your heels, and bring your chest down toward your thighs. Rest your forehead on your hands or a folded towel. Now, place your palms on the sides of your lower ribs. This is crucial. Breathe in slowly through your nose and feel your ribs expand outward and backward into your hands. Your chest should barely move. If your shoulders are rising toward your ears, you are failing the movement. Your belly and your lower ribs must do the work. Then, execute a long, slow exhale through slightly parted lips. Why does this specific position work? In child's pose, your pelvis is physically elevated above the level of the pelvic floor. This creates a gentle mechanical stretch on the perineal muscles. Gravity is doing the heavy lifting for you. Each breath cycle sends a rhythmic pressure wave from your diaphragm straight down into the pelvis. On the inhale, the diaphragm drops and nudges the puborectalis gently open from the inside out. Over time, this acts as a deep tissue massage that no external therapist can reach. When you are doing this correctly, you will feel a distinct warmth or a sense of widening in your sacral region, that triangular area at the very base of your spine. That sensation is the muscle finally yielding its grip. Movement 2, the supported deep squat. Stand with your feet wider than your shoulders, toes angled outward. If you feel unsteady, hold on to a door frame or the back of a sturdy chair. Lower yourself slowly into a deep squat, going as low as you comfortably can. Here is the absolute clinical rule. Do not tuck your tailbone under. Keep your pelvis neutral and your lower back straight. As you inhale, direct your entire focus to your pelvic floor. Feel your sit bones gently moving apart, as if the base of your pelvis is softening and widening. On the slow exhale, feel a light, springy lift. The deep squat is the most effective natural position for pelvic floor release known to human anatomy. Before the invention of modern ceramic thrones, humans eliminated in a squat, and for a very good biological reason. In a full squat, the anorectal angle reaches its maximum opening. The puborectalis sling reaches its maximum stretch, and the muscle receives a clear neurological signal that it is safe to release. This is exactly why cultures where squatting is a part of daily life have dramatically lower rates of constipation and hemorrhoids. It isn't just about their diet, it is about their structural position and muscle length. This exercise accomplishes what a bottle of laxatives never will, because laxatives only address the output, while the structural blockage remains entirely untouched. A safety note before you start. If you experience sharp, stabbing pain in your back or pelvis during these movements, stop immediately. Sharp pain is a signal that your condition needs an in-person clinical evaluation. Self-directed exercise is powerful, but it doesn't replace a hands-on exam if your symptoms are severe or progressive. Keep this in mind while you work. The objective is never to squeeze or tighten. You are seeking the sensation of gentle widening. Your body will find its own safe range of motion as your breathing deepens. Do not force it. Execute these 2 movements every single day for 2 weeks minimum. Now, look at the age factor. The way your pelvic floor responds to stress changes significantly after 45. Your connective tissue loses its elasticity, and the symptoms that were manageable at 30 become impossible to ignore at 60. I'm asking you, seriously, how old are you right now? Write your age in the comments. Understanding the demographics of who is watching this channel determines what content I produce next, because the exercise tolerances I discuss depend entirely on where you are in your life cycle. Here is your takeaway. One small, deep muscle, the puborectalis, controls your internal pressure, your spinal stability, and your digestive health. When it breaks down, it creates a cascade of chronic pain, leakage, and fatigue. In the vast majority of cases, the problem isn't weakness, it is a chronic, suffocating spasm. And that spasm is being fed by the very Kegel exercises the industry told you would fix it. The system doesn't benefit from you fixing this for free in your living room. It benefits when you are cycling through endless specialist appointments and buying prescription creams for symptoms that start in your pelvis. I'm not interested in that arrangement. Subscribe to this channel and share this with someone the system is trying to keep in a cycle of management. I'm Dr. Elias Thorne. I'll see you in the next one.